Mental health has really hit a crisis level the last year especially, leaving a lot of schools to try and find solutions as we begin a new school year. Governor Gavin Newsom's new $4.7 billion master plan for kids aims to do just that. So how will this money be spent? Well, they say they're going to create a pathway for 40,000 new mental health professionals, hiring 10,000 more school counselors, offering scholarships for mental health workers who work in a school for 2 years, and then also loan forgiveness for people in the behavioral health field.
What we are announcing here today is just one component of our comprehensive strategy to systematically connect dots and address the issue of mental health and behavioral health once and for all.
Yeah, so the governor's office went on to say that more than 284,000 young people right here where we live deal with major depression. And get this, 66% of those cases go untreated. Meanwhile, the suicide rate for children, kids between 10 and 18, it went up 20% from 2019 to 2020. Joining us live now, Dr. Barbara Bentley, a clinical psychologist at Stanford Medicine Children's Health. Doctor, thank you so much for joining us. Let's really start this out in this spirit. We cannot afford to lose one more child to suicide. We can't afford to have kids suffering out there when they need to be going to school and learning. How do you think about this plan? What do you think about this plan? And how do you think it will help our kids?
Well, thank you for having me. I think that during the pandemic, all of our resources that we use to have good mental health have been stressed. And so this is very timely that we have new funding to serve a wider range of individuals. So this plan is going to serve children birth through 25. And then the way to establish that pathway is really to bring in more mental health clinicians that are not just clinic-based, but also school-based, and serve children and families where they live.
You know, and sometimes I think it takes a community that pays closer attention to the kids around us, really follows with our hearts and our intuition. What are some of the symptoms we should be looking for? And we're not just talking to parents, right? We're talking to aunts and uncles, grandmas, grandpas, neighbors. What should we be looking for with kids that may not have the words to say, I'm hurting, I'm suffering?
It's a very good question. Mental health or mental health issues look differently in different age groups. But in general, when we see a child struggling at home, either with hyperactivity, irritability, mood issues like depression or anxiety, it will impact either daycare or school, but also their peer relationships. So as parents and teachers and providers who are working with children, we really want to see if a child is having any functional problems in their home, their school, or daycare, and with their peer relationships.
You know, it's humbling. I'm a dad, I have kids in school, and sometimes you get that child comes home from school irritable, and you just want to sort of correct the irritability. I've had to stop myself and say, why is my child coming home from school feeling irritable? And how, you know, as a parent, can I talk to my kids about their mental health and do it in a way that preserves their humanity and gives them sort of a safe space to say, yeah, I'm hurting?
Well, I think the best way to speak to your child is to ask, how are you feeling? And if they're not able to have words for that, you can say, I'm noticing and what you're seeing. Because irritability can be about a child feeling overwhelmed and that they don't know what to expect, but it also can be driven by anxiety. So I think that just starting to ask the question and talk to the other adults who might have insight about what happened in your child's day is a good way to try to do the investigative work about what might be going on for your child.
It's so easy as a parent to say, this behavior is bothering me, it's difficult in the home. It's a harder job, but a more important job to say, why is the behavior here in the first place? Dr. Barbara Bentley, thank you so much for joining us. This is a life-saving conversation, a pleasure to have. Thank you so much.
Thanks for having me.